All right, what's up, everyone? So, welcome to another free weekly lecture on pediatrics. So, a couple of things that I want to talk about today before we get started into our lecture in pediatrics. We're going to do some high yield pediatric review, especially with infectious disease, and then we're going to do some practice questions as usual, and then we'll call it a day as we're getting ready to get into our upcoming course. Our course does start tomorrow. It starts tomorrow morning. If you're having any qualms about registering, please let us know and we'll reach out to you and we will make sure to answer any questions regarding it. It is the last course of the year. It is the last full course of the year. There will be no courses in December. The next one will be in January. So those of you that are having any last minute doubts about taking it, take it. If you're getting ready to take your exam in December, take it. It's going to be taught by myself and Nurse Brittany, and we start tomorrow morning. So again, you do get 2 months worth of your self-paced live videos access. It's got all the notes on it as well too. We do have payment plans. So make sure if you have any questions, please feel free to reach out to us by filling out this form. Or you can email us right away. If you email us right now at contact@NCLEX High Yield. If you email us at contact@nclexhighyield.com, we will make sure to reach out to you right away and get you enrolled so you get your welcome packet and you're there ready to rock tomorrow morning or tomorrow afternoon in some cases. All right, so a couple of things. We did get a little word that looks like the NCLEX are going to be changing. We don't know to what extent it's going to be changing. So as we get information, we will relay it to you. But we do expect some changes, whether they be minor or major. There will be some sort of change coming here in April of next year. And as things are getting updated, we will keep you notified. We will be adjusting everything accordingly as well too. So we will be being the first people to release everything as they come out. So make sure that you stay tuned to us. Subscribe if you haven't. Subscribe to us. We just did put out a new video. It was a top 10 drugs that can cause visual disturbances. So make sure you watch that. The PDF is a free download. It is a free download. So email contact at nclexhighyield.com if you have any questions regarding these. And again, with any changes, make sure you're following us. Make sure you're subscribed to our email. Everything will be coming out. If you are subscribed to us, whether it be the videos or on YouTube, Instagram, Reddit, whatever it is, make sure that you're following us because we will be putting out announcements regarding the new upcoming tests as they are given to us as well. So, with that said, let's get into a short lecture here on pediatric infectious diseases. So, we're going to start with the 4 that typically come up, and they're a great case study. They're a great case study. We've got chickenpox versus measles versus mumps versus, you guessed it, rubella. So why are these so high yield? Because 1, we have vaccines to them. 2, they're very prevalent. And they make for a great next-gen question. What is the next-gen question type? Well, it could be a bow tie. Yeah, absolutely. It could be a bow tie. It could be a case study. And if you look at the different things that have included in here, identifying what the infectious disease is. Then we're going to look at what causes it, the different types of treatments, what intervention, most importantly, what are the precautions that we're going to use, and is there a vaccine for it? Is there a vaccine for it? The other things that they're going to ask for are signs and symptoms. The signs and symptoms that they're typically going to look at is, do they have a fever? Do they have any type of swollen glands? What type of a rash they have? And then we're going to talk about treatment as well too. So the first one is chickenpox, which is your varicella zoster virus, your VZV. Most of these viral infections, what is the treatment that we're going to do? Well, before we even think about medication, the number one thing that we're going to do is going to be supportive care. And with varicella zoster virus, is a little tongue twister. With varicella zoster virus, we're going to do supportive care in the form of acetaminophen for the fever. We do not give aspirin. We do not give aspirin in a viral infection. This is 100% a further teaching, further intervention type of a question. Further teaching, further intervention type of a question. Why? Because aspirin in a pediatric patient can cause Ray's syndrome. What are the signs and symptoms of Ray's syndrome? Or what are we freaking out about? Altered mental status. This is a child that comes in and they are obtunded. They are lethargic or grunting, ask Graf. They are unresponsive. Why? They're unresponsive because they've developed encephalitis. What is the only exception that we can give aspirin in a pediatric infectious viral process? What is the only exception to giving aspirin in a pediatric viral infectious process? And those of you that are saying it, I'm reading it in the chat. Yes, you're 100% right. It is Kawasaki's. That's the only exception. And we go into that detailed. We want to get them on antihistamines. They're going to get itchy. If anybody's ever had chickenpox, it is this intense itching that you feel. So give them an antihistamine, calamine lotion, oatmeal baths. And in the case that we do need to get them on medication, the pharmacological therapy or intervention is, in fact, acyclovir. What are the nursing interventions? And I want everyone to kind of realize this. What type of a question have I started to develop? A bow tie or a case study? What are the actions to take? What is my management of care? What is my basic care and comfort? When I go over your CPR reports with you, I speak to many of you that I've spoken to. If you've spoken to me on the phone, please put it in the chat. I'm just curious how many of you have actually gotten a phone call from me, because a lot of people don't believe I call people, but I do. I go over your CPR report and I go, look, they're going to talk about pharmacological therapy, acyclovir, antihistamines. They're going to talk about management of care, basic care and comfort. These are the ones that are heavily weighted and they're everywhere. I may not label it, but it's also your logical deduction and critical thinking. So there we go. We've spoken to a couple people, and now we've got to worry about precautions. And with varicella zoster, we're worried about contact and airborne, and we want to prevent that scratching. And when can we remove them? We can remove them when the lesions are crusted over and there are no new lesions. I see, look at how many people have gotten calls from me. Look at that. So many. Nurse Elizabeth, Nurse Mary, Nurse Anric. I remember all of these people. Nurse Toyin, I remember as well too. Yeah, I remember speaking to you all. So with the lesions, we want to make sure they're crusted over and then they're not going to be contagious anymore. This is a live vaccine. This is a live vaccine. And when do we give it? 12 to 15 months, and then again at 4 to 6 years. Where does the vaccine schedule come into play? Growth and development. Growth and development. All right. The next one is measles. And the measles virus, again, viral infection, what can we give? Acetaminophen, hydration, humidifier, and the treatment is, in fact, vitamin A. In this one, we're going to put them in a negative pressure room with dim lights. Again, airborne precaution. And this one, if they're immunocompetent, anywhere from 72 hours to 4 days. This is also a live vaccine. Same time that we're giving it. Growth and development. The next one is mumps. With mumps, again, supportive therapy. And in this one, we're worried about enlarged testicles. So enlarged testicles or testicular pain. And it's going to be very sensitive. So when a child sits down, they are going to be very uncomfortable. They're going to be fidgeting all the time. And again, droplet precautions. And they will develop this parotid swelling or parotitis. Parotitis or parotid swelling will happen about 5 days after. Sorry, we can remove them from precautions 5 days after the parotid swelling begins. Sorry. And again, this is part of your MMR vaccine, so that 12 to 15 months. And the last one is rubella. This is your German measles, and this is again a viral infection. So we're going to do supportive care. Again, that management of care, basic care, and comfort. This one is very important because we were going to keep away from pregnant patients. Droplet precaution, and when is it going to be okay to be around this patient? 7 days after the onset of the rash. Again, time frame. Why do I give you time? I give you time because time, age, anatomical location, again, these are there for a reason. And this is part of our MMR vaccine. Any questions so far? The way that I used to remember measles, it's in your quick tip book, which, by the way, I just got wind of it today. Quick tip books are going on sale for Black Friday. So if you don't have a copy, I think they're regularly $39.99. I think they're going to be like almost half that price. So just keep an eye out for it. They're going to announce it soon. So if you don't have a copy of it, make sure you get a copy of it. It's going to be really, really cheap, relatively speaking. But the way I used to remember it is I used to remember measles by saying measles. And I know it sounds really silly, but a lot of my ways of remembering these things are very silly, but they worked for me. M for measles, A for vitamin A is a treatment, and the C for three C's. And I actually even stretched it a little bit more, and I made it where the last C, I made the K and complex spots into a K like that, a K with a C. So that coryza, the nose being irritated, the cough, the eyes being irritated, and the complex spots. Signs and symptoms of measles. Treatment, simple, vitamin A. Those of you that watched the drugs that cause visual disturbances, what was one that I talked about? That's a vitamin A derivative. Isotretinoin or Accutane. It is a vitamin A derivative and it can cause that visual disturbance as well too. So look for toxicity. Remember the six ways that we can talk about pharmacological interventions. And again, I tell you, over the counter stuff and vitamins and minerals, antibiotics, antivirals, all medications, and over the counter vitamins and minerals are all going to be treated like pharmacological questions. So know the six ways that they can ask them. Identify the drug, know its use, side effects, contraindications, and remember the four N's. The four N's for airborne precautions: N95 mask, negative pressure room, no open doors, and if you are going to be leaving the room with the patient, they must wear a surgical mask. They must wear a surgical mask. Those of you that have, you can take a picture of this, I don't mind. Those of you that have the course, you have a very pretty version of this, a new updated version of this. In the notes, you will get those. Those of you that are in the course, you can download them. If you have the subscription, you can download them. There's a way prettier version of this, but in this format, this is kind of how we condensed everything in there without giving away the nice new notes for free. So those of you that are part of it, you have a very pretty version of this. Some other genetic disorders that come up in pediatrics, and then we'll talk about these more in depth. Cystic fibrosis, it is a genetic disorder. But the problem with this is what? We cannot keep chloride in, which means that sodium chloride is going to exit our body by the largest organ that we have. And that organ is, in fact, the skin. So imagine that I can't keep sodium chloride or salt in my body. So what's going to happen? It's going to excrete all the salt through my skin. And we already know what follows sodium: water. Does this become a form of dehydration? It does. And dehydration is everywhere. So know your signs and symptoms of dehydration. Do they differ from infants to pediatrics to adults? Yeah, they do differ. However, the concept is still the same. So understanding how it may present physically with signs and symptoms, it's very important to differentiate between infants, pediatrics, and adults. Pediatrics, I'm saying not infants, but pediatrics above infants, because infants are very, very tiny. So the way they present is very different, all because of dehydration. Think of all the different ways that dehydration can present and know it inside out. This patient is not going to be able to keep salt in, water won't stay inside. They become very dehydrated, and it ruins the pancreas because everything's become viscous and thick. So all the secretions in the lungs start to get like a mucousy plug. Those same plugs affect the pancreas. So what are we going to do about it? Well, we'll talk about that here shortly. Always worry about their airway, airway, airway. A patient with cystic fibrosis is not going to die, or more than likely is not going to die, if we are dealing with a pancreatic issue. That becomes like malnourishment, malnutrition. However, with the respiratory infections, the respiratory failure, that's more than likely the way that they're going to pass. So nursing care, we get into this heavily in both pediatric GI and in respiratory. The next one is Down syndrome or trisomy 21. This is an intellectual disability. They've got that characteristic facial features of flat face. They have the hypotonia as well too. Again, they are more susceptible to different types of infections, so screening is very important. Trisomy is, or Down syndrome is, correlated with a lot of other diseases as well too. But the developmental milestones, as we talk about in growth and development, is very important to see if we're hitting those monitors, and remember to do a quad screen. Another one is childhood obesity. Now, nowadays, we're worried about both malnutrition and obesity. But in this situation, what are we going to look at? Childhood obesity. Why? Huge topic on the boards. But this comes down to one major concept. And that concept is needs. And if you don't know needs, again, and I was just talking to a student today about this, and I go, look, when we're talking about management of care, basic care and comfort, even therapies, pharmacological or parenteral therapies, I was like, needs is in there. But the boards aren't going to just put nutrition on there, exercise on there, ETOH on there. To say is, in fact, what are we going to do about a patient that is at risk for childhood obesity? Well, first of all, risk factors. There's a select all that apply question. And now we've got a child that has a poor diet, lack of physical activity, nutrition, exercise. Genetics we can't get around. That's something that's a non-modifiable risk. And then socioeconomic status we can't as well too, but we can educate. We can't help a child's socioeconomic status. I would consider that a non-modifiable risk factor. But we can educate them, or we can educate their caretakers. Because even at a young age, you'll be surprised, especially this day and age. I've got kids, pediatric patients, or family members, or family friends, or students, children that are sitting there that are like, my kid knows how to read the back of a nutrition label. They're looking at trans fats and saturated fats, and they know the difference. They're looking at the protein content. They're looking for the different dyes that are cancer causing. So in that situation, it's not socioeconomic status that's going to affect them. It's education. So educate them on their needs, on their nutrition. So instead of grabbing that chip, maybe they grab an apple. At this point, I feel like both are comparable in price. It's just educating. So what are we worried about? Well, we're worried about long-term issues. And those that have been with me in so many different issues, we talk about diabetes, type 2 diabetes in, oh, can y'all hear me? Can you hear me now? Oh, sound. How about now? Can you hear me now? It's cutting in and out. Clearly, we can see you. Yes, we can hear you. It's cutting off. Okay, so for a few people, it's cutting off. But for the most part, everyone else is good. Okay, cool. Awesome. Thank you. Thank you for that. Okay, so those of you that have been with me for a while, what are we looking at? We're looking at long-term ramifications from childhood obesity. That's why it's such a high yield topic because look, type 2 diabetes they're going to develop, hypertension they can develop, cardiovascular disease they can develop. How about psychosocial issues? What about mental health? So the importance of childhood obesity is significantly high on the boards and in real life. We can prevent type 2 diabetes, hypertension, cardiovascular disease, dot, dot, dot. So, what are we going to do? It's still coming and going, huh? I know there's a storm here, but um, let me see. So I'm getting like mixed. So I'll just continue going and then we'll try and put this up on YouTube. I'll get an exception to put this on YouTube at some point. I don't know when because the holidays are coming up, so I can't promise anything, but I'll try to do that just so you have it. All right. So, what are we going to do? Our nursing interventions are going to be look at their BMI, dietary habits, activity level, again, all stemming back to needs. Nutritional counseling, physical activity, family involvement, especially in pediatrics. It's so imperative that we are involved in their day to day. What are they eating for breakfast? Are they eating breakfast? Now, I know socioeconomic status, those that know my story know for a fact that I didn't have the ability to eat food when I was growing up. Those of you that know my story know it was milk. And even at that, that's very expensive nowadays. But educate them on what they can afford. Budget with them. Family involvement. It's that extra care that goes a long ways with us being nurses. Now, look, I just spoke yesterday to one of our nurses who's going to be doing an interview. And I didn't just talk to Nurse Morgan about passing because Nurse Morgan was actually a one-on-one student of mine. I actually spoke to her mother. And I was so impressed at how involved the family was in everything that they were doing. But ultimately, the goal is that this is what Nurse Morgan said to me was, "Hey, I can't wait to take that extra step with my patients because that's what I'm here for." So talking to the family about their nutrition consumption or the child's nutritional consumption is very important. Take that extra step. It may take you 5, 10, 15 minutes, but it's worth it. Educating and educating. The ones that we're concerned about with pediatric trauma and emergency care are going to be drowning, poisoning, fractures, and burns. Why did I bring this up in pediatrics? Why did I bring this up in pediatrics? Because in mental health, what can this be indicative of? The drowning, maybe not so much. Abuse. Yeah, if you're having issues, just try to refresh your browser. It should be okay on our end. Yeah, abuse. Remember the burns, the fractures, poisoning, drowning. So again, remember the different risk factors, how to identify it, what to do if you do identify it, so on and so forth. And now let's get into. So I took a few questions here and there, put them together because I didn't create a full blown case study, but what I did was I took bits and pieces of it. And I made a matrix grid. What are the signs and symptoms for each one of these diagnoses? So the ones that we're looking at, fever, swollen parotid glands, pericarditis, maculopapular rash, Koplik spots, or pruritic vesicular rash. Pruritic vesicular rash. An itchy pustule or water pustule. So with varicella, mumps, measles, rubella, can we develop a fever? Well, how do we work each one? We go column by column. So with varicella, with chickenpox, anybody ever seen a patient with chickenpox or had it themselves? You develop a fever. So we'll go one by one. Yeah. Yeah, absolutely. With varicella, with chickenpox, do you ever see a child with a parotid gland that's swollen? Not so much. No, that's not one of the signs and symptoms of varicella zoster. How about a maculopapular rash? Yeah. How about Koplik spots? Well, remember I told you I spell Koplik like this so that actually let me do this real quick. So it looks like a C that makes that K. And we talked about that with. So no Koplik spots. And how about the pruritic vesicular rash? With mumps, again, the signs and symptoms. Are we going to have fever with mumps? Yeah, we are. What about the swollen parotid glands? Well, I just think the word mumps sounds like lumps. So, as silly as that sounds, mumps and a swollen lump kind of worked for me. So, that swollen parotid gland worked for me. Rash with mumps. No. Koplik spots with mumps. No. Vesicular pruritic rash. No, as well. With measles, again, fever. Yes, absolutely. This one and this one are going to be super high yield right now. If you're going to get a pediatric infectious disease process, mark my words that your case study or your bow tie is going to be what you're looking at right in front of you. Why? Why do I make this point so relevant? Guess what's very prevalent right now? Chickenpox and measles. Anybody read the news in the US? Those of you that are from outside the US, if you read the US news right now, there are breakouts of measles everywhere. And the boards tend to love stuff that's in the news, stuff that's very relevant right now. So measles, 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 very solid. This is, if you get a pediatric infectious disease process, super high yield. Do measles have the parotitis? No. But do they have a maculopapular rash? Yes. Do they have complex spots? Yes. But are they pruritic vesicular rashes? No. No. And the last one is rubella. Does this cause fever? Yes, they all cause fever. They all cause fever. So anything that we want to test you on a case study, a matrix grid type of a question, is going to be 100% things that can compare and contrast. And this is exactly what I'm doing here. Will this have a maculopapular rash? It will. Complex spots? No. And is that rash pruritic and vesicular? No. So again, you have to calculate how many you got right and do the math. Don't dwell on ones that you don't know 100%. Now we're going to talk about basic care and comfort. Basic care and comfort is very important. Again, another matrix or grid in the same case study. I didn't want to make a case study because I want to address all four of them. So in this situation, I'm going to do the same thing. I'm going to do the basic care and comfort, the management of care, and the basic care and comfort. Am I going to give them pyretics? Well, in every one of them, I've got a fever, so yeah. Fluid intake, isn't that part of supportive care? Yeah. Educate on transmission prevention, absolutely. Analgesics for pain, yeah. And vitamin A supplementation, basic care and comfort, any type of pharmacological or parenteral therapy? No, not in this situation. What about with mumps? Fever, antipyretic? Yeah. Fluid intake? Absolutely. Educate transmission prevention. Well, we talked about transmission prevention in every one of them. Analgesic for pain? Absolutely. Basic care and comfort. With measles, same thing. Fever, fluids, transmission, pain management. In this situation, we are in fact going to be giving vitamin A supplementation. And the last one is rubella. And again, the same thing. Administer pyretics, yes, fever, fluid intake, transmission, and pain, but no vitamin A. So basic care and comfort management of care, very straightforward. Made that one very straightforward for you. Now, this question is an example. And the reason why I want you to look at this question is because I tell you that the boards are always changing. Now, when everyone's just to read this question, a nurse is educating parents about the prevention of common pediatric infectious disease, which measures should be included, select or apply, ... hand hygiene, vaccination, blah, 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 blah. Why did I make this red? Why am I even pointing this out? People are going to tell you certain things. People are not going to notice certain things when they teach you. When people teach you regarding the boards, I can make a question like this for you, but is this going to be really relevant to how the boards are going to ask questions? Not at all. Look at the same question and watch how I've written this question. So you notice we're able to answer this. How quickly can everybody answer this question? Boom. Let's start right now. I want everyone to answer this as quickly as possible. And don't copy the answer above you. And now what we're seeing is you're able to answer these questions pretty straightforward. And how long did it take? It didn't take long for everyone to answer these questions looking at this. I've taken the exact same question and made it into a board style question. And now the same exact question is going to present on the boards just like this. Now time yourself and see how long it's going to take. Now you know that the answers are similar, but which intervention should the nurse emphasize as evidence-based measures to prevent the spread of viral and bacterial illnesses in children? What is the situation? We're providing anticipatory guidance to caregivers during a community health visit regarding strategies and to reduce the transmission of high-risk pediatric infectious disease in both home and group setting environments. Whoa, do you realize how much longer it takes? Why did I do this? This is where I'm gonna take a little bit of time right here to help you study. When you're studying for the boards, remember, why do I make you do 440s? I make you do it so you can sit for 5 hours and time yourself and not run out of time. Timing is key. Do you know how many students send me their CPR reports and I'm like, whoa, you were so close? And they tell me, I got up to 136 questions, I ran out of time. I got up to 141 questions, I ran out of time. Now you can pass by running out of time, but if you didn't pass and you ran out of time, those extra 14 questions, 9 questions, they can put you above. They can be the difference between a pass or a fail. Now, if you're doing really, really well, 136, you can get a pass by all means. That doesn't mean rush. That means train yourself. This is a marathon. You're not going to run 5 miles just by putting your mind to it. You have to literally work hard at it. Your reading speed and comprehension has to increase because now, look, not only did the question stem become more intense and longer, so did the answer choices. So now, if you're giving me a select or apply and I'm looking at true or false, now I have to sit here and read every single one. Encourage exclusive and continued breastfeeding when possible to enhance passive immunity and reduce infection risk. Whoa, that's a mouthful. But why am I going to encourage breastfeeding to enhance passive immunity? Well, let's think about this. And I'm going to go into more of our pediatric infectious disease. And I'm going on a complete tangent. I want to run out of time here. Okay, cool. Let's think about this. I want everyone to pay attention real quick. Look at this. Why would we want to encourage that breastfeeding? Because, well, what is going to be transmitted or what's going to be passed from breast milk to baby? If we can pass IgA, immunoglobulin A. It's a part of our immune system because is a baby born with an immune system? No. Can mom give it to baby? Yes. Where do we see a situation where we need to boost somebody's immune system? We'll think about again, go back to that Kawasaki's disease. Again, huge, huge, huge topic. So that immune system, those immunoglobulins are huge. Administer prophylactic or routine antibiotics to reduce the likelihood of common viral and bacterial illnesses? Absolutely not. We're not trying to get them to develop resistance? Absolutely not. How about limiting the child's exposure to large group settings or crowded indoor environments during periods of increased community infection? Absolutely. You know the flu is going around. I mean, just think about it. Those of you that have kids, nieces, grandkids, whatever it is, or that those of you that work in pediatrics, you walk into a setting like that, you're going to get sick. It's just gonna happen because that exposure is there. And now we want to limit that. Yeah, especially if there's increased community infection. Ensure the kids remain up to date with all age appropriate immunizations according to current vaccination schedules. Now, yeah, that's a straight up easy true. But the point is that it's a longer read. So it takes me a lot longer to read it. And when you get tired, how many of us do this? I do this all the time. I read it and then I go back and I reread it. And I reread it. What did I just read? I'm so tired. What did I just reread? Then the last one is reinforce meticulous hand hygiene practices for both caregivers and children, especially before meals and after toileting. When do you say the opposite? You don't. You don't. So again, it's very important to understand that these questions, they take a lot longer. So when you're studying, don't just focus on getting it right. Also focus on time and reading and comprehension. Let's see what that was there. Okay, so look at this one. Those of you that have taken the exam before, remember these types of questions? Yeah, there was like 265 questions that you'd have to do, but they were like this. And then even when it dropped to 130 during COVID, they were still kind of like this because they weren't trying to keep you in the testing center for an extended period of time. Well, now, this same question, how quickly can you answer that? Pretty simple, pretty simple, straightforward. Yeah, you can answer that one real quick. But take that same question and now try reading this at 145 questions, or this being your last question. How tired are you at this point? Which intervention using the method, again, which intervention should the nurse identify as a priority to promote physiologic stability and prevent acute deterioration? Wow. That's just the last part of the question. Let's see what's going on now. We're caring for a pediatric client diagnosed with cystic fibrosis. Okay, we talked about that. Who is experiencing an exacerbation characterized by increased respiratory secretions and reduced airway clearance. So what are we going to do? Well, again, here we go with schedule airway clearance techniques such as chest physiotherapy on an infrequent weekly basis to assist with secretion mobilization. Limit the child's oral intake to avoid overhydration during periods of respiratory compromise. Administer prescription pancreatic enzyme therapy with all meals, snacks to compromise. To optimize nutrient absorption and gastrointestinal function. And then the last one is implement nutritionally restricted meal plan, emphasizing reduced caloric intake to prevent excessive weight gain. So in this situation, we're going to do the or and or. I just wanted to show you this, but I'm going to make one adjustment here on it. This should be on a frequent basis. On a frequent basis. So there's a little typo in there because I try to make it longer and I myself got fatigued. So yeah, so what are we going to do in this situation? We've got increased respiratory secretions. Am I worried about fluid intake? Probably, but not as much as getting that airway clear. So using the method, I probably go with D, right? Again, look at the situation. It is exacerbation with increased respiratory secretions and reduced airway clearance. So yeah, is B correct? It is correct. but is that the one I'm going to do right now? And I just made the adjustment. So am I going to do frequent basis to assist? Yeah. Yeah. So I want to do the airway clearance techniques. So what are some airway clearance techniques? Chest physiotherapy, repositioning, vibration, administer prescribed pancreatic enzyme replacement therapy with all meals and snacks. Yeah, we're going to do that. But right now we're worried about airway. So I'm going to go with airway above that. And then nutrition, again, I'm going to go with airway right now because of the situation. Because of the situation. So with that said, suctioning is a good one as well too. Repositioning, vibration, the actual chest, the vest, as well too. So again, in this situation, we're trying to clear the airway. Are there a lot of different ways we can word this? That's a select all that apply question. Perfect. Yeah, absolutely. What are ways that we can clear the airway? 100%. 100%. So with that said, again, very important that we understand that the old ways versus the new ways and the content, test taking strategies, everything that you can think of is all there. Now, with that said, really quick, the weekly Zooms may be coming to an end. So try to take advantage of them as we are doing them. The weekly Zooms may come to an end. So try to take advantage of them as we do. Make sure you're following us on all social media platforms. And again, we'll let you know when our last one is. There'll be a last hurrah. And then with that said, if I did anything to offend anybody, I apologize. If there's any way that I can get better, please let me know. If I made mistakes, again, I'm sorry about that. We'll go back and make some edits. You know, sometimes I'm just talking off the top of my head and I make mistakes. I'm only human. So I'll say something, but I mean something else. So know what I mean, not what I say. And we don't know when it's going to end, but it will be ending. So make sure you're following us on all our social medias. I'll be posting more and more videos on there. But the weekly Zooms, we're not sure about yet. If the demand comes back, we'll be here. If the demand comes back, we'll be here. Trivia will be starting up though. We'll be doing trivia randomly. It won't be an hour long. It may be 20 minutes. So it might be a quick little, 10-minute question, 20-minute, or sorry, 10 question trivia, 15 question, 30 question, who knows. They're all working through all these kinks to see what it is. So that way we have more interaction for people at different times as well too. Remember, the course starts tomorrow. If you need to go and get what's it called, the scholarship people did get their let me just double check that. Hold on one second. The scholarship did get announced, and then as far as discounts, if you email contact at NCLEX High Yield, they will walk you through everything. I don't know what discounts are available. Sorry, I don't deal with the finances, so that's going to be something that our admin deals with. So you can definitely talk to them. Push them. They might give you a little discount. Who knows? I can't guarantee anything, but no harm in trying. So again, we will definitely be letting you know when the weekly Zooms do end. But if we could get more people to come in, they're going to keep it around. So just start spreading the word. The next one that comes up, just start spreading the word on everything. The more people that we get to participate, the more they're going to allow me to do more for free. So we just need more and more people. So spread the word. And then other than that, everyone have a wonderful, wonderful day. Again, if you're going to be in class tomorrow, I'll see you bright and early tomorrow morning. And if you're debating again, it is the last course of the year. So I will see you all tomorrow. And if not, then I'll see you at the